Hello friends, welcome to our channel. Today we should give review on concussive medicine. Well, you can see this concussive is popular Ayurvedic medicine, commonly used in the treatment of respiratory conditions. So it's particularly used for treating asthma and infective disease like bronchitis, common cold, and it can also be used to treat the gastrointestinal disturbance. Okay, so these medications contain several natural herbs which help in the improving the function of lungs and protect the pulmonary tissue against damage. So these have been used for centuries and can provide effective relief from acute as well as chronic conditions. So now coming to the ingredients, Sharkara, Shaudra, Kanaka. Kanaka means Dhotura. Vrisha, Madhuka, Magadhi, Vyagri, Keshara, Visho Vishaja, Varangi, Talishpatra, Dhataki, and Draksha. So, what is the indication and benefits of this medicine? Well, in the case of bronchial asthma, it induces the dilation of the air passages and reduce the tightness in the chest. So regular use of this medicine can reduce the frequency of asthmatic attack. And it also effective for upper and lower respiratory tract infection like common cold, sinusitis, pneumonia, tuberculosis, bronchitis. Okay, so it reduces the production of mucus in the respiratory passages, and it also has natural mucolytic action. That means it has liquefaction properties on the thick mucus. Okay, and it has also antibacterial and antiviral action. Now it also very good general tonic that can be used by people suffering from emaciation and malnourishment to gain weight. So, what is the dose of this medicine? For children, 1 ml to 2.5 ml. For adults, 6 ml to 15 ml. Twice day with equal quantity of water after meal. And it should not be used in children under 5 years. Okay. So there are no side effects of this medicine. But if you take higher dose, then it may cause burning sensation sometimes. But there are some contraindication, like in the case of pregnancy, breastfeeding, tachycardia, glaucoma, patient with pacemaker. Okay. So thank you for watching. See you in the next video.